Good day, everyone. You're welcome to my YouTube channel, Everything Medical. On today's video, we shall be appreciating the lumbar vertebra, that is the lumbar spine. If you are coming across to my channel in your first time, remember to subscribe, like, comment, and also share our video so that other students will see the channel and also benefit from it. Without wasting much of our time, let's quickly dive into the business of the day. Now, here on my hand is the third segment of the vertebra we have in the human body, which is the lumbar vertebra, the lumbar spine. It is situated on the lower back between the thoracic vertebra superiorly and the sacral vertebra inferiorly. Now, you have to understand that all the vertebral bones are irregular bones. They are irregular bones. They don't have a definite shape, right? Now, this vertebra has a large vertebral body and centrum. That is one of the distinguishing features it has from other vertebrae. Now, what is the vertebral body or the centrum? Now, this is the vertebral body. Here is the vertebral body, right? All these are the vertebral body. Why this is the centrum, right? So it has large centrum and the vertebral body. And that is why it has the ability to work on weight bearing of the body. Among other vertebrae, the lumbar vertebra is the largest. It has large vertebral body and also large centrum, followed by larger transverse processes. But on the area of the large centrum and the body it has, that is why it has the ability to withstand or bears the weight of the body. Other vertebrae does not play a role on weight bearing compared to what the lumbar vertebra does. Now, for example, this is the thoracic vertebra. You can see that the thoracic vertebra has smaller centrum and vertebral body compared to the lumbar vertebra. Now, between thoracic and lumbar, which one do you think can bear the weight of the body? The answer is the lumbar vertebra. And if you watch the lumbar vertebra, the vertebral body is usually kidney shaped, while for the thoracic vertebra, it is what? Heart shaped, right? Go and watch my video on thoracic vertebra. I've made a concise video on that bony structure, right? So you can see that it is unique compared to other vertebrae. Now, the lumbar vertebra does not have much bony facet compared to what the thoracic has. The actual reason why the thoracic vertebra has much bony facet for articulation is because of the ribs. And that is why on the joint of the lumbar vertebra, it only has a joint that is found throughout the entire vertebral bones. It does not have a unique joint for itself. The actual reason why the cervical vertebra and the thoracic vertebra has a unique joint for themselves is because the thoracic vertebra articulates with the ribs, while the cervical vertebra, particularly the atlas and the axis, has its articulation, and also the atlas articulates with the base of the cranium, that is the occipital bone, occipital condyles, right? So the joint of the lumbar vertebra is only one, which is the one that is articulated throughout the entire length of the vertebra. That is between the vertebral bodies and the vertebral arc. As we proceed, we'll get to discuss that. So the next feature we shall be discussing are the characteristic features of this bone, right? What make it to become unique? The first is the large vertebral body, which I've said earlier. It has what? A large vertebral body made up of large centrum for the weight bearing of the body, right? And it is usually directed deeper. It is directed deeply than posteriorly, producing lumbosacral angle, which is an angle between the long axis of the lumbar region and also the sacral region. Another thing it has is that it has a triangular shaped vertebral canal or foramen. Look at it here. It has a triangular shaped vertebral canal or foramen, which allow the passage of the spinal cord. It has a clinical correlation, which is called the lumbar spine stenosis, whereby there is a stenotic condition or narrowing of the vertebral canal, right? Whereby it will cause lesion or damage to the spinal cord and also the existing nerves, right? The next feature it has is the transverse process. You can see the transverse process is usually long and slender. It is long and slender, but it has no articular facet because it does not form any articulation with any bony structure. It is not like the thoracic vertebra that each transverse process has a transverse costal facet for articulation of the tubercle of the corresponding rib, right? Likewise, for the body of the lumbar vertebra, it has no any articular facet because it does not articulate with any rib. But if you watch the thoracic vertebra, it has superior and inferior costal facet for articulation of the head of the corresponding ribs, right? Those are their differences. Now, the next feature it has is the spinous process. You can see this is the spinous process. The spinous process of the lumbar vertebra is short and bifid. It is short and bifid, right? Or it is short and broad, not bifid, please. It is short and broad. It is not like the spinous process of the axis that is long and bifid, right? So this one is short and broad. That is the spinous process. It is short and broad. The next feature is the articular processes. Now, these are the articular process, right? This is the articular process here. This is articular process. This is also articular process, where we have the superior articular facet and we also have inferior articular facet, which articulate the corresponding vertebra, because this is where they fit in. They have two joints. The one on the vertebral body, which is formed by the intervening intervertebral disc, and the one that is formed by the articulation on the vertebral arc, because this is the joint between these two regions. Here is the joint that is formed by the vertebral arc. 1, 2, 3, 4 are for the vertebral arc, while here and here are for the vertebral body. As we proceed to the joint, I will also lay an emphasis on that area, right? So this bone is so much essential. The next feature it has is that it has what we call the accessory processes. The accessory processes is actually found on the posterior aspect of each of the transverse process. It's found on the posterior aspect of each of the transverse process, which provides the site of attachment of the deep muscles of the back, right? Now, watch here. This is the region in which the deep muscles of the back attaches on the transverse process. So we'll call it the accessory processes. The next process it has is the mammillary process. This mammillary process is actually found on the posterior aspect of each of the superior articular processes, which also provide site of attachment of the muscles of the deep back, right? The muscles of the back, or the deep muscles of the back, to be precise. It is not the superficial muscles, the deep muscles of the back, right? Majorly on this region, because here is the superior articular region. So the deep muscle of the back also attaches on this area here, because here is the superior articular region, right? You have to understand that here is the lamina of this bone. This is the lamina. Here is the lamina. right? And here is the pedicle. Pedicle. As we proceed, we'll get to know more of those features properly, right? Now, the next we shall be discussing are the joint. I've made a, a statement earlier that the joint of the lumbar vertebra is only for those joints that is found throughout the entire length of the vertebra. The lumbar vertebra, to be precise, does not have a unique joint for itself. It is not like the thoracic vertebra and the cervical vertebra that has their unique joint and also has a joint that is found throughout the entire length of the vertebra. The first joint that is found throughout the entire length of the vertebra is the joint between the vertebral body. Here, the joint that is found here. And the joint between the vertebral body is a cartilaginous type of a joint, which is formed by the intervening intervertebral disc. It is made up of a fibrocartilage, which unites all the vertebra, right? It is unite all the adjacent vertebrae. The joint is usually found on this region and also here. It is a cartilaginous type of a joint that is made up of a fibrocartilage, right? Which is formed by the intervening intervertebral disc. Hence, it is called the symphysis, right? It is called the symphysis. Now, before I proceed further, you have to understand that this bone is only 5 in the body. It's only 5 in the body, right? It's only 5 on the lower back. And among that 5, from L1 to L5, L5 is the largest because it has broader vertebral body and the centrum in bearing the weight of the body, and also have longer transverse process. So you could see that from L1 to L5, the L5 bears the much weight. All the weight of the body are rested on the L5. L5 is bigger, both the vertebral body and the centrum, in order to bear the weight of the body, right? So that is how it works. The next joint is the joint between the vertebral arc. That is the second joint that is found throughout the entire length of the vertebra. The joint between the vertebral arc is a joint that is formed between the superior and inferior articular processes. It is a synovial type of a joint. That joint is formed between here. This is the superior articular facet. This is inferior articular facet. So the corresponding vertebra or the adjacent vertebra usually fits in here with its own inferior articular process to fit in into this facet to form a joint called the superior articular joint and also inferior articular joint. That means a vertebra or an adjacent vertebra will situate here, while the another one will also situate here to form a joint. So they usually fit in on each of their centrum, that is the vertebral body, and also fit in on each of their superior and inferior articular process. That means there are 2 joints on this bone, between the vertebral body and between the vertebral arc. That is what I call it, the 2 joint. It does not have other unique joint for itself. And that 2 joint is found throughout the entire length of the vertebral bone. So that is how it works. The next feature we shall be discussing are the ligaments. The ligament. The ligament of the lumbar vertebra is very little too. It only have its unique ligament and the one that is present throughout the entire length of the vertebra. We shall be starting with the one that is present throughout the entire length of the vertebra. We have number 1, the anterior and posterior longitudinal ligament. The anterior and posterior longitudinal ligament is usually found throughout the entire length of the vertebra, which unites all the vertebrae and covers the vertebral body and also the intervening intervertebral disc. That is the anterior and posterior longitudinal ligament. It covers the vertebral bodies of all the vertebrae and also their intervening intervertebral disc. The next ligament that is found throughout the entire length of the vertebra is the ligamentum flavum. This ligamentum flavum connects the lamina to the adjacent vertebra. Here is the lamina. That means it connects the lamina of each of the vertebra to the adjacent vertebra. The next one is the interspinous ligament. Interspinous ligament connects the spinous process to the adjacent vertebra. That means it connects the spinous process of a vertebra to the corresponding vertebra. The next one is the supraspinous ligament. The supraspinous ligament usually connects the spine, the spinous process, to the adjacent vertebra, right? It connects the tip of a spinous process, to be precise, the tip of the spinous process to the adjacent spinous process of a vertebra. That is how it works. The difference between the interspinous ligament and supraspinous ligament is that the interspinous ligament connects the spinous process of a vertebra to the adjacent vertebra, while the supraspinous ligament connects the tip of an adjacent spinous process to another vertebra. That is how it works, right? Now, let's quickly look into the ligament that is unique for the lumbar vertebra. We have discussed the ligament that is found throughout the entire length of the vertebra. Now, let's discuss the one that is unique for the lumbar vertebra. We have the iliolumbar vertebra. The iliolumbar vertebra is actually a fan-shaped vertebra. A fan-shaped ligament. Iliolumbar ligament is a fan-like ligament that radiates from the transverse process of L1 vertebra to the ilia of the pelvis. That is the ligament. It is peculiarly and unique for the lumbar vertebra, right? So, the next feature we shall be discussing are the anatomical relations. When we talk about the anatomical relation of this bone, we refer to the spinal cord, right? Now, recall that the spinal cord passes through the vertebral foramen of all the vertebrae. Now, when it gets to the lumbar vertebra, particularly the L1 lumbar vertebra or the first lumbar vertebra, it terminates. As it terminates, it forms the cauda equina. And the cauda equina is comprised of the lumbar, sacral, and coccygeal nerve root, which forms the cauda equina, right? That means the spinal cord terminates at the level of the L1 vertebra. However, there are some other relation that is related to the lumbar vertebra, that is starting from L1. We have the crura of the diaphragm, the right and left cruise of the diaphragm. Recall that the right cruise of the diaphragm extends from the L1 to L3, while the left cruise extends from the what? L1 to L2. So those are important landmarks or important events that happens on the lumbar region. That is the lumbar bone, right? Now, the last but not the least is the clinical correlation of this bony structure. We have the lumbar spine stenosis. Lumbar spine stenosis is a stenotic condition or a narrowing condition whereby the vertebral foramen becomes smaller, it becomes more narrow, thereby causing lesion or damage to the spinal cord and the existing nerves, right? Now, how does it occur? It is worsened by age-related degenerative condition of the vertebra, such as bulging of the intervening intervertebral foramen, right? And when this happens, it can be surgically be corrected, whereby there is a decompressive laminectomy. That is a surgical procedure to treat it, because already it will compress the spinal cord and also cause lesion to the existing nerves, right? So that is all about the lumbar spine stenosis. And stenosis simply means narrowing. It is a medical term for narrowing, stenosis. The next clinical condition is the lumbar spine lordosis. The lumbar spine lordosis is a condition whereby there's an excessive anterior curvature of the lumbar spine, whereby the lumbar spine is directed anteriorly. Because if you watch, the thoracic kyphosis is when the thoracic spine is excessively curved posteriorly, creating a hunchback. But for lumbar spine lordosis, is an excessive curvature of the lumbar spine anteriorly, whereby it is directed anteriorly towards the inside abdomen, like it is curved on this manner, creating an depression. It creates a depression, please, not an depression. It creates a depression, right? So that is how it works, and it can be corrected with surgery, right? So that is all about the lumbar spine lordosis, whereby there's an excessive curvature and of the lumbar spine anteriorly, not posteriorly, anteriorly, right? You can see it on this picture. This picture will give you a clearer view of how it works. Thank you so much for staying to the end of this video. I so much appreciate.